warm welcome to all of you, especially those of you who travel from afar to be here at GS1's Global Healthcare Conference, Hong Kong today. Anna and I actually went back quite a few years ago when I was in my last job dealing with economic development. At that time, we focused our energy on RFID development in Hong Kong. I'm so glad that after I moved to the present job as Permanent Secretary for Health about 3.5 years ago, then we find something else to do together again. But for 20 years, GS1 has provided an invaluable platform, amongst its many other functions, for stakeholders involved in providing and managing healthcare to share best practices and innovative ideas through its healthcare conferences as well as its many other activities. GS1's growing membership is in itself proof of its increasing significance, especially in the area of information technology application to healthcare. So, like a very good party girl, I would never miss a great party like this, and I asked to be invited. It is actually my very great pleasure to be here, and indeed to play host to the finale of this year's Global Healthcare Conference in the Asia-Pacific region. As Chris just said, this year's conference on raising the bar on patient safety and supply chain efficiency also has a special meaning and relevance to Hong Kong, as it well echoes our vision in building a territory-wide electronic health record sharing system as an essential healthcare infrastructure to provide more efficient and better healthcare to the community. So I'm very happy to share with you the latest development of our EHR sharing system today. Now, first of all, I must declare, I'm not a doctor. I know very little about IT. I am a trained generalist to be a policymaker in the Hong Kong government. But over the years, one thing that has always excited me is that we are a city which believes in innovation, in creativity. And regardless of what you think about civil servants and all the red tapes we churn around you, actually, we believe in breaking new grounds. And I'm very glad that in the last 2 years, we have managed to bring our stakeholders together, our doctors, pharmacists present, private hospitals, many other in the healthcare provider section, the airline health, physiotherapists, everybody else. And we build a consensus in Hong Kong that we need to develop a citywide e-health record system for our population. Then, of course, like Chris said, there's the politics. Although I'm responsible for a budget of about 30 billion Hong Kong dollars for the public health care in Hong Kong, I need new money to do the system. So we spent quite a few months trying to lobby our legislature, the politician, to vote the money for us. And I'm very glad that actually shortly before their summer break, they gave us the money. So we have money, commitment for the first 5 years at about 0.7 billion Hong Kong dollars, and for the commitment for the whole budget that will be about 1.1 billion Hong Kong dollars to build the e-health record system. So what's our vision? What do we want? Because we understand and we realize the advance in information technology has actually drastically transformed the operation and management of the healthcare supply chain, and we realize that the potential, and realize that government worldwide have all embarked on programs to develop their own e-health record system one way or another, but the purpose is to enable sharing of patients' medical records and other healthcare information amongst healthcare providers. In our view, at the micro level, an e-health record system should foster the records follow patients concept, thus enabling our patients to carry their lifelong comprehensive health record to wherever they go within the healthcare system, and allowing healthcare providers anywhere within the system to have access to these records when they have the patient's consent. I can't emphasize more that in our vision for the Hong Kong EHR system, it is a patient-centered system. No one will have access to it without the patient's consent. So we believe that an intelligently designed EHR system should provide the right information, as Chris just said, all the rights, right information at the right time, in the right format, to the right person, so that the right doctor can deliver the right care. An even more sophisticated information system should also support decision-making and other expert system functions. This I will elaborate later. Now, this is really at a micro level, at the individual level. It's a relationship between the patient as well as your healthcare provider, your doctor, your physiotherapist, your nurses, and others, and the pharmacists. But at the macro level, how do we look at it? We're a city of about 7 million people growing, and we'll probably reach 8 million some years down the road. And we're talking about 9 million later. So at the macro level, an EHR system must encompass medical records of the whole population and provide a base for real-time disease surveillance, especially for infectious disease. I'm sure when you've flown in or when you're in Hong Kong, you hear all the announcement on board the plane and you're going to fill in a healthcare form because of the influenza A, swine flu, H1N1. Now, this is infectious disease surveillance.